IBS and you're also losing your hair, what could this mean? First off, the loss of hair and a lot of the things that we're about to talk about that can contribute to losing hair aren't directly a symptom of IBS, meaning IBS is not a malabsorptive condition like some other gut conditions, including IBD and celiac disease. So it's really important to make sure we talk about that. However, hair loss, losing hair, as well as mineral deficiencies and other signs of malnutrition can be secondary to other things that either are due to IBS or overlapping with IBS. So let's talk about what some of those things may be. The first reason that you could be losing hair is that you actually don't have IBS. So like I just said, maybe you have IBD that hasn't been fully identified, celiac disease, or even conditions like endometriosis or PCOS may then cause hair loss, and now they're being masked as IBS. So that's really important to discuss with your healthcare provider. Ensure that IBS is a confident diagnosis as well as the only diagnosis that you're working with. Now, the second major cause that I see most often in my practice is actually stress. Stress can contribute to hair loss as well as the different behaviors that come out of being more stressed. We know that stress can also exacerbate IBS symptoms, and living with IBS can cause more stress. That is the gut symptom brain cycle that a lot of people deal with. And so that's something that we may want to assess is stress over time and how that may be overlapping with the hair loss. With an increase in stress, we also may want to look at the role of the thyroid and thyroid function and how things are going there. In addition to stress, another major cause of hair loss that we do see sometimes in those with IBS is malnutrition. This means that we are not meeting nutrition needs, therefore hair loss and poor hair growth is going to occur. This is where we may also see different deficiencies. We may see dull skin, brittle nails, other signs of malnutrition, and maybe even some weight loss and muscle wasting. Typically, this is going to be secondary to either an increase in symptoms that are uncontrolled that leads to loss of appetite and poor intake, due to fear. So increased fear may lead to unnecessary restriction and over restriction of calories and specific food groups and nutrients. Or it may be due to what I said before, another condition that's actually interfering with absorption of nutrients. So not an IBS, right? So we don't see this in IBS, but maybe with celiac disease and IBD. And another major cause that may not be full-on malnutrition, meaning we may be meeting overall nutrition needs in terms of calories. We may not have muscle wasting. We may not have weight loss or other signs of malnutrition, but you may have folate and B12 deficiencies. Now, this can actually be due to poor stomach acid production, which can be related to stress and poor behaviors around meals and even increased fear around meals. But this could also be due to the use of acid-reducing medications that then decrease B12 absorption. Now, these are not going to be used specifically for IBS, but these might be used more for GERD and reflux, which again can overlap with IBS. When it comes to hair loss, there's not a one-size-fits-all answer of what may be causing it, but it is important to go into your history and look at this full picture to see what may be contributing and what other signs and symptoms may be present that will then tell us what we need to do in order to see your results. Then may be able to influence the treatment plan and our approach for reversing the problem.